My name is Dr. Shmuel Shields. I'm a nutritionist in private practice in Queens for approximately 30 years now, and I'm going to do a series on family health and specifically children's health. Um, I'd like to suggest that we have, unfortunately, a health crisis in the community when it comes to the health of children. Now, when I use the word health crisis, that often means different things to different people. So, as a healthcare practitioner, I want to just share my clinical observations with you in terms of who I've seen over the years. Specifically, I do work with a general population, but I do see a number of children. And this is basically an unprecedented clinical observation. Um, what I think happens is sometimes we accept things as being the norm. Oh, it's usual for kids to get sick. It's usual for kids to have these kind of problems and those kind of problems. But what I'm going to present to you for this first part of the series is not the norm. It shouldn't be the norm, and we shouldn't accept it as the norm. Um, but here's what I've seen over the years: cavities. Okay, children get cavities, but I've seen kids with numerous cavities, and I've even seen kids 7, 6, 7, 8 with root canals. Now, a root canal puts it into a different status. Usually we think of middle-aged people getting root canals, but we now see them in children. And then we have a concern of childhood obesity, which is almost an epidemic, um, but it's gotten worse over the years. Um, Childhood obesity is a serious problem because the longer a child has excess weight, and as he goes into adulthood or teenage years and so on with carrying excess weight, it leads to health complications down the road. Um, I've also seen a number of kids that are coming to me because they already have elevated lipid levels. What I mean by that is elevated cholesterol levels. Um, and then I also have seen children with elevated glucose levels, some of them in the pre diabetic range, with A1Cs um, that put them pretty close to being pre diabetic. Um, so these things we shouldn't see in children this age, and nevertheless we are. So when I say a health crisis in the community amongst children, these are the types of things that I'm talking about. A lot of these conditions, unfortunately, we do see in adults, middle-aged adults. It might be a little more common to see some of these things, but to see them in such young children has to strike a chord and has to make us more alert to what's going on. So I'm just trying to make us more aware of the health problems so maybe we could address them in a different way. Also, I just want to stress that I'm just giving, health awareness, health education, information. I urge you to work with your healthcare professionals before making any kind of lifestyle changes. Um, I'm just going to continue my list a little bit. Strep, ear infections, cold, flu, and other respiratory infections are on the rise. And there are some children that are on continuous, I mean continuous, rounds of antibiotic therapy. This is not the norm. It shouldn't be this way, and we have to be very proactive in these areas. We also see compromised physical activity. We do live in a technological, digital, electrical world today, and electric scooters and things like that have taken over. The pedaling bike has been, pushed aside. So there's very limited physical activity, and that also has, health consequences. Um, so what I want to do now is I just wanted to introduce some of the concerns, some of the issues, and we're going to continue with the next series on the detrimental diet that plays a very important role in some of these areas.